a scientist in a lab, which has a lot of like technical things you do with your fingers. So that was like not looking good. Typing on a computer was not looking good. Like it was literally like my whole life, everything I was all not looking good without an arm. I was diagnosed with breast cancer 2 years ago, and I underwent treatment. When I finished radiotherapy, I started losing feeling in my arm and in my hand, and I developed some lymphedema. I started having trouble doing really simple things like doing groceries or picking up my daughter, who was 2 at the time. Cooking even was hard. Things like typing on a computer. And I had this like dull pain all through my shoulder, and it was just constant. A year later, I was diagnosed with a radiation injury to the nerves that run to my arm, and I was told there's nothing you can do, this is permanent, and it could get worse. I felt like I was trapped in this damaged body, and I didn't know for how long it was going to be like that. My radiation oncologist referred me to Dr. Evans to try hyperbaric oxygen therapy. And before doing that, like if someone asked me, how's your arm doing? I'd say, like, it's a disaster, this is permanent, like I don't know what to do. And but if I really thought about it, if I thought back like 3 months or thought back 6 months, I'd be able to say, actually it has improved a little. So I had like very slow improvement. But I came here and I tried hyperbaric therapy, and after around like week 3, I started seeing changes. I started getting more feeling back. I had less weakness. All the swelling was gone. I was just like looking at my hand like, whoa, look at those fingers. And I went home and I was like, I bet my wedding ring fits again. And yeah, it did. So that was awesome. And I healed in ways I wasn't even planning on. I had post-mastectomy pain. All that pain was gone. All of the pain was gone in general. Like I don't even know how to describe to somebody to lose so many things and to suddenly start getting them all back in the span of 7 weeks. Like it was amazing, and I'm so thankful to have found you guys here. As a patient, I can say that it's really easy to do hyperbaric treatment. It's really pleasant to come here every day. All you have to do is be patient, really, and just sit. You get to watch TV while you're inside the chamber, and you just wait for the healing to start. Sitting here with Dr. Evans, who is a radiation complications expert and hyperbaric medicine specialist. So what's happened to me with my case, is that sort of the typical way things go?
Well, you were fortunate that you only had your radiotherapy about 1.5 years ago, and you haven't had time for the radiation injury to fully go through the unfortunate thing which they call it a fibroatrophic march, and that means it's going to become instead of nice, supple, normal tissue, it's getting to be more like leather and fibrotic. And it starts to become less and less functional. And so in your situation with the MRI results showing that they had swelling of the nerves and they were angry, those kinds of situations, in the early stages, this is very typical of what we would expect to see. Resolution over a period of weeks. In some cases, if it's been delayed and it's been a few years since the radiation has been provided, it might take us several months to actually achieve the same thing. But we would expect to see some improvements in those cases.
So would hyperbaric medicine work for any kind of radiation injury?
In fact, it works wonderfully on most every radiation injury, whether it's skin, bone, muscle, fat, any tissue that's been injured. The similar radiation injury that's occurred responds very well to hyperbaric oxygen therapy.
So who should seek hyperbaric medicine, and when is the best time to do that?
Radiation-related effects are not commonly discussed in the general medical field. It's the suffering that goes on, and after years and years of suffering, patients show up, and in fact they just needed to be here as soon as they develop their symptoms after the radiotherapy. And it doesn't matter what symptom they've got, if it's affecting how they get on with their life, they need to get that managed, because we have solutions for that.